Wonderful. Good evening. We have the hour of 7 o'clock has arrived and we do have a quorum. So we will call this meeting to order. Jessica, do you want to, we call the roll for attendance?
Yes, we certainly can. Well, you call and then there's a suspension of the rules.
Oh, I need a motion to suspend the rules for us to participate in this meeting virtually. Do I have said motion?
Yes.
Motion to suspend rules.
Yeah.
All right, I have that Derek moved to suspend the rules. And do I have that Archana seconded?
Sure.
Perfect.
Second.
And so I will take a roll call vote. Archana?
Here.
Kathy?
Here.
Thank you. Samantha? Chair Olds-Fry?
Yes.
Thank you. Amanda?
Yes.
Thank you. Vice Chair Ohanian?
Aye. Yes.
And Cherie?
Here.
Great. Thank you.
Wonderful. And with that, we will begin our meeting. We do have a quorum and we need to approve the minutes from two meetings, February 10th and March 10th. In order to do that though, do we need, is it just a majority? Because not everyone who was here for those meetings. Can they?
Correct. So anyone can vote. I actually checked this with our legal department. Anyone can vote on meetings because our meetings were recorded and posted. But again, it's at the will. Kathy, if you'd like to recuse yourself.
Well, thank goodness I backtracked and looked at all the videos.
Perfect. And I want to make sure that everyone knows that Demita, welcome. You've joined us as well. So why don't we approve the minutes and then we'll make sure that we have a moment for introductions as well. So I need a motion to approve the February 10th minutes. Do I have a motion?
I move that we approve the February 10th minutes.
Thank you. Amanda moves and I need a second.
Second.
Thank you, Derek. And with that, we'll call the roll.
Thank you. Archana?
Here. Yes. Sorry.
Thank you.
Missing out.
Kathy, did you want to vote or recuse? It's up to you.
Yes.
Okay, thank you. Chair Olds-Fry?
Yes.
Thank you. Amanda?
Yes.
Thank you. Cherie?
Yes.
Thank you. Demita?
Yes.
Thank you. And Vice Chair Ohanian?
Yes.
Thank you.
All right, wonderful. And then we will need a motion to adopt the March 10th minutes. Do I have a motion?
I move that we approve the March 10th minutes.
Thank you. Amanda moves and I need a second for the approval of the minutes.
I second.
Thank you, Demita. And with that, we'll call the roll.
Thank you. Archana?
Yes.
Thank you. Kathy?
Yes.
Thank you. Chair Olds-Fry?
Yes.
Amanda?
Yes.
Thank you. Cherie?
Yes.
Thank you. Demita?
Yes.
Thank you. And Derek? Oh, I'm
Yes.
sorry. Thank you. Vice Chair Ohanian. Sorry.
All right. And with that, our next item on the agenda is public comment. I did know that we wanted to take a moment to just make sure that our new members had a chance to introduce themselves. Should we take that moment perhaps prior to public comment? Kathy?
Sure. That sounds great. Oh, am I
We
doing
are
the introduction?
Yes, we are so excited to have you. And if you want to just give
I
all
was-
of the those in attendance and those on the working group, just a brief overview of your background so we can welcome you and get to know you a little bit better.
Okay, well, I'm going to keep it very short because I know you guys have a lot of stuff to do with this coming up a holiday weekend. So my name is Kathy Hayes. I was born and raised here in Evanston, so I'm a townie. I was born and raised in the Fifth Ward. I subsequently grew up there and was educated there. And I then moved to Chicago for a few years because employment was there. I worked 24.5 years for county government. I have had other jobs regarding social services and direct services in and out of Chicago, as well as in Evanston, because I started in Evanston. I'm a grandmother of 3. They're very tall kids. I'm the shortest one in the whole family. I don't know what happened, but they're grown, and also are all of my grandchildren and my daughter also live in Evanston. Currently, when I returned to Evanston, I bought a small place in the 9th Ward, and I have been living here for about 7.5 years.
Perfect and welcome. We are so happy to have you on our committee.
Thank you. I'm gonna try to keep up with everybody.
You're going to do just great. All right. And with that, do we have any public comments? You can either raise your hand or you can enter it into the chat. And if you don't have any comments at this point, we will revisit towards the end of the meeting as well, assuming that we continue to have time to do so. All right. I'm not seeing any public comments, so we'll go ahead and go to the ARPA living room program update. Jessica, is this you?
This isn't actually. I am working to promote Anne Rainey,
There we
who
go.
is, oh, good. Yes.
Ah,
Anne
Just
Rainey is the executive director of Turning Point.
Council members Burns and Reed should be joining us shortly. We had a meeting that ran long, sorry.
shall I go ahead, Jessica?
Absolutely.
Yes, please.
Okay. Well, I appreciate the opportunity to speak with you tonight, and I am so happy that the City Council on March 28th voted to award ARPA funding for the establishment of a living room program in Evanston. We will be located on the campus of, is it Ascension St. Francis, I think? I don't know if it's still Amita. Anyway, the St. Francis campus in a bungalow that will need to be rehabbed. And tonight, I'd like to tell you about what the program consists of, what our record has been. Happy to answer any questions that you may have. But the first living room in Illinois was established at Turning Point about 10.5 years ago. The state was looking for psychiatric respite opportunities for adults. And so we were asked with another organization to open 2 living rooms in the Illinois area. And we did. We followed a plan that we intend to follow in Evanston, which is we began with speaking with focus groups and interviewing first responders and families and people who lived in the neighborhood. And we made a fairly comprehensive list of people that we thought would have an interest in our living room program, and asked them how they felt about the program, what they thought the neighborhood and community needed. And then we launched the program in September, 10.5 years ago. Since then, we've had a 99% success record at keeping people out of a higher level of care. That means 99 out of 100 people do not need to go to an emergency room, are not arrested. They're able to return to their homes and their families and continue on with their lives. And that has been a really important aspect of our program. the way that happens is that any adult 18 years or older may present themselves to the facility. They are very briefly screened and admitted to the living room, which looks very much like a living room. The living room in Skokie is part of our building, and we're located just south of Main Street on Skokie Boulevard. So the living room in Evanston will have its own building, but to describe what it looks like now in Skokie and what we do, the living room looks like a living room. It has tables and soft seating and chairs and alcove where someone could rest or sit quietly. There are materials for meditation and yoga. There are materials that relate to methodological approaches like cognitive behavior therapy and dialectic behavior therapy. So what happens is the adult who says they are in crisis, and crisis is whatever it means to that person. We don't argue about that. We don't ask them for any kind of qualifications. We also do not ask them for money. This is a grant-funded program. And when someone presents themselves in crisis, we want to do everything we can to remove the barriers to their coming in and getting things resolved. So asking, identifying information or proof of insurance, that sort of thing really makes it much less likely that we can form a strong bond quickly. So it is important for me to stress that this is a free service. And what happens then is that the guest is paired up with an adult who has a lived experience of mental illness, and they're called recovery support specialists. And they are trained people who are meant to sit down with the person who comes into the living room and hear what they need, what they think they need, what their history has been, and do whatever they can to resolve the problem that the adult presents to them. Often what happens is the recovery support specialist shares their own journey of recovery. They talk about their own experiences with anxiety or crisis. They offer suggestions about what might be done. They might use some of the methods that I mentioned earlier that are really evidence-based. They also might teach someone how to meditate or suggest that they try to learn some yoga postures. But as I said before, when someone comes in crisis and we don't know what that is, it could be that they've lost a job, for example, or they've lost a job and they haven't written a resume in years. And so we might take them into a computer area where we'll sit down and look at models for how to put together a resume, how to look for a job. So the living room also has a very strong resource component that's very important, because sometimes the crisis is you need information or you need to know how to do something. Something that is wonderful about the new Evanston program is that we're going to include staff from peer services and from impact behavior health partners in the Evanston living room. So an individual who has concerns about substance use or who is worried about employment will have a skilled person they can meet with immediately. I'm really excited about that. Peer and impact are both tenants in our Skokie building, and we've worked together with them for years. It's just a pleasure to think that we could provide integrated care in this bungalow. So most guests stay for about 2.5 hours. On any given day, between 8 and 12 people may present themselves. We've never had to turn anybody away. We also, I checked this, we've never had any sort of physical altercation or worry about violence that has led us to call the police or to call for help. And I want to emphasize that because I know that, especially as we come into a neighborhood where there are families and homes, I'm sure that people have questions about what the nature of the guests may be. And you know, one of the things that I think it's important to emphasize is that for the most part, our guests choose to come to the living room. So they're not remanded, they're not forced, it's not conditional upon something. And I think that probably adds into the factor that they are not violent and for the most part are really seeking help. We use something called the Suds Scale, which measures units of distress at the beginning and the end of a visit. And that's one of the ways that we know that people are really feeling better when they leave. They're not, let me put it positively, anyone may come as often as they wish to the living room. And that means that some people come fairly often. Some people only come when they need help. Some clinicians actually kind of orient their clients who may have anxiety issues or may often be in crisis to the living room so that they can find the building. The police and fire often talk to their community residents about where the living room is and how they get to it. One of the ways that we have gotten to know our residents in our community is that lots of us are on community boards and organizations where we know other providers, and we have an opportunity to talk about what we're doing and also to get feedback about what needs to be adjusted. So what we hope to do is to mirror in Evanston our Skokie schedule, which is 7 days a week, 365 days a year. We open at noon and we close at 8. That time frame really has to do with how often crises tend to happen. And interestingly, late in the afternoon and early evening seems to be the time that most crisis calls are made. I think it may be because people are getting home from work, they're reconnecting with their families. But at this point, that's what our funding allows us to do. The living room model is really meant to extend hours as far as it possibly can. So as we are able to get more funding, our intention would be to increase those hours. But at this point, it would be 7 days a week, 8 hours a day. The staffing is usually between 3 and 5 people at any given time who may be in the living room. And I think when we're in Evanston, one of the wonderful things about that location is that our provider colleagues from Trilogy and Peer Services are both working in the emergency room at St. Francis right now. So we look forward to getting referrals from them, to working together with them, to seeing how many more things we can do just because we have the proximity of the hospital in the emergency room. And I've been talking with St. Francis about ways that we can maybe offer some groups in their professional building or kind of build off our living rooms so that we can provide more services that may be needed. That's the overview. And I am curious about questions you all may have or things that you'd like me to explain or
Thank you
describe.
so much, Anne. That was so thorough. And I know as you were walking through, I had certain questions in my mind that you answered as you went through your presentation.
Oh, good. Great.
So it was really incredibly helpful. Kathy, you have a question.
Yes, I actually have 2 questions. They're very quick.
Sure.
What is the plan for the neighborhood education? I know you have heard from some neighbors that they don't understand what the living room is for or how it works. What is your plan to educate the neighbors in the community? Because they were a little antsy about this development in their backyard, as the man said.
Right.
And my second question is, after the Arpa funds, what are the funding options that you have to continue the living room?
That's a great question. I'll answer the second one first. We have just applied with Mayor Biss's support for earmarked funding from Representative Schakowsky for year 2 of the living room. That is absolutely not a sure thing, but we're making efforts to try to get 2 years of funding pulled together, because in year 3, all of the living rooms in Illinois have to renew their funding. And so I'm hoping that when we get to year 3, we'll convince the Department of Mental Health to open a budget line for the living room in Evanston. And although, again, I can't be sure of that. I've been talking with our contract manager for the Department of Mental Health about the Evanston initiative. And I would hope that as long as we do as well as we've always done, that will be very likely. So I think the first 2 years are really critical. And that's the plan for that. In terms of the neighbors, I went to the ward meeting, the 8th ward meeting about 10 days ago. And I think it will be important for me and the staff to continue to go to those meetings if that's helpful. I also wonder if there are other groups of neighbors in that area who get together or who might just want to, you know, have coffee and invite us to come and talk about the living room. I really understand that when a new model comes into your backyard, literally, it's hard to know exactly what it looks like and how it may develop. And I can share our 10 years of experience, and I hope I can really put some of the fears to rest, but I also think it'll be important, concurrent with our being open, to receive people's concerns about what is going on, or invite them in to ask their questions in the living room, or to have a way to get word to the staff that there is a question or a concern. So I think we need to build the relationship, and I don't want to presume that anyone feels any more comfortable about it than they do. So I think it's just a process.
Well, if I may ask, could you also include the 9th ward?
Of course. Sure.
And that because we're backed up straight
Yes.
to Councilmember
Absolutely.
Burns' Reed's area as well.
Sure. Oh, yeah.
Yes.
Thank you.
Happy to do that.
If I can jump in very quickly and just say that, one, thank you, Anne, for coming to the meeting. And since
bet.
the meeting, I've had some residents reach out and raise some concerns, but none of them were about the location. The biggest concern I've had is about an alley that is right next to the building, and we're making sure that that's paved so there's not a bunch of traffic kicking up dirt. But that's a good problem. I mean, I'm really glad that neighbors, and this is a neighbor who's directly abutting it, who said, I'm happy this is going to be here. I just want to make sure that my alley is taken care of. So really promising, really promising stuff here with community support, and thank you.
And I'd love to come back to your meeting whenever it's the right time, because as a therapist, well, and a human being, I know that it's important to have second thoughts, second conversations, repeated conversations. We can't just have one conversation and cover everything. That would be very unreasonable.
Okay, thank you. Demita, you have a question.
Yes, thank you. And when is the center in Evanston slated to be open?
You know, that's a great question. And I was talking to the mayor the other day, and a couple things need to happen, I think, before we have a firm schedule. The hospital and the city are talking about who will be renting the space, leasing the space, and also how and when we're going to be building out the space, because at this point, it's not habitable. There may be electricity, but it wasn't on the times I was there. It will need really an overhaul of its systems, heating and air conditioning. So I don't know what the expectation is around how long the rehab will take, but as soon as we have some dates, we'll start to hire people who I hope will come into the community and begin to just talk about what our work will be. I wish I knew those dates. My guess is that within the year we'll be up and running. We'll do that as soon as we can, and if there's a way to even do it, out of another space in the hospital proper, we can do that. But I promise that I will let this committee know as soon as we know that.
Okay, thank you. My other question was, once that happens, is it a possibility that maybe before it's open for participants, that maybe as a way to help the community is have a time where they can actually come into the space to walk around and kind
You
of
bet. The other thing I want to offer, and Councilman Reed and Burns did this, was to invite anyone to come over to Turning Point in Skokie and walk through our living room program and hear about it and hear about it from the staff. I don't know how to organize that, but the door is really open for that. So if we put together a group of residents and representatives who wanted to come, we'd love to show you what we do and what it looks like. But absolutely, we'll have some tours before we open for business.
Thank you.
And even then, you know, people are welcome to come in. It is by no means a closed facility. So I have been in the living room when people have come in and said, I don't know if it's okay for me to be here, but I was in a car accident today and I'm really shook up. Could I just talk to somebody? So we have a lot of individuals who come in for circumstances that are not necessarily related to mental illness or a longstanding problem. In fact, I have said this, I know to some of you, but it's interesting that in this year to date, more Evanston residents have come to our Skokie living room than Skokie residents. So I'm hoping that we can just give them the good news that they can stay in Evanston if they wish.
Very interesting there, and thank you for pointing that out as well, and for the offer for the tour. I think that many committee members may be interested in that.
Sure.
I know several folks are on their phone, so I want to pause and see if there are questions from other committee members. Councilman Burns?
Yeah, not a question. Just wanted to acknowledge Demita, because it was actually, she put it on my mind to ask Ms. Flax about inviting the folks from Turning Point here to speak tonight about the living room. And I think it's such a great idea. And I want to acknowledge it while also encouraging other committee members to do the same. If there's ever someone or some organization that you think we should meet with here on the committee, feel free to reach out to myself or Sarah, or and we can get them on. So that's all. Thank you, Chair.
Thank you so much.
Thank you for that suggestion. I sort of grabbed onto my courage and what little confidence I have, and I preached at St. Luke's Church a couple weeks ago, and that gave me an opportunity to talk to the parishioners who are very interested in the living room. And if you are involved in faith communities or cultural communities who have an interest in the living room, I'm available.
Thank you so much. I had one other question, unless other committee members have questions. Anne, you talked about budgeting and sort of first year and hoping to figure out second year. And then third year, I think the DHS budget, the state budget. We didn't talk about what the budgeted amount is.
So the living room costs about $650,000 a year to run, with no fees for our participants, our guests. And that includes two positions, one from Peer and one from Impact. So one of the things that we've talked about with Peer and Impact is that in year 2, and certainly by year 3, they will be able to bill for their time in ways that will let us drop off about $150,000. So I think as we look forward, we're looking at like $450,000 to $470,000 for an ongoing budget.
Wonderful, very helpful. Thank you. All right. I'm seeing no further questions. Thank you so much, Anne, for such a thorough overview. It was really enlightening, and I'm glad that you're here to present to us today. So
I'm delighted.
For your time.
And Jessica, I wonder if you could be our contact person. If you know of folks here who might want to visit or have questions, you know how to find me.
Thank you. Absolutely. I'd be happy
Okay.
to arrange
All right.
that.
Thank you, everybody. I really appreciate this. Have a good night.
All right, we're moving to the next item, which is the 2022 funding allocations. And Jessica, I will turn it over to you for.
Great, thank you so much. So I do have a slide. I would like to share my screen, and I can make this as quick, or I'm happy to take more time if people need. Can people see my screen?
We can.
Perfect,
Yes.
thank you. Okay. So we are here tonight to talk about the 2022 allocation recommendations. So many of you remember our condensed application and allocation process for 2021 funds. Agencies, received news of their awards and agreements really in the last quarter of the year. It was very challenging, but many were able to expend all of their awards for 2021. Some were not, we'll talk about that. But for those agencies that were able to fully expend their awards, they now need commitments for 2022. Also, agencies that maybe were able to expend a partial or carry over some funds would also like that commitment. So that's why we're here tonight talking about allocation recommendations for 2022. Okay. I should have flipped to this slide. So there were 3 agencies that carried funds over, and that was the Housing Authority of Cook County, Child Care Network of Evanston, and YOU. And we can talk about those agencies a little bit further. We do have report outcomes for 2021 available for the committee's consideration. And my next slides will be going over those outcomes. So I will speed through. If there are questions, please jump right in. I can't see anybody's screens or faces, so feel free to jump in, please. Okay, so for case management agencies, the metrics that we're looking at are really their ability to enroll new Evanston residents, and then the total number of Evanston residents served, the number of service plans that were created, and the client contacts that those agencies were able to make with their people on service plans. For safety net services, we're again looking at new and total Evanston residents enrolled in the program and served. And then we're looking at the number of safety net service hours and the types of services provided. So for case management, it's a little bit more streamlined. We're comparing apples to apples, but with safety net, it's a little bit more challenging because that isn't always the case. In both cases, we looked at referrals to outside organizations, but agencies aren't necessarily ranked on the number of referrals. It is just information gathering at this point. Okay, so for case management agencies, this chart does sort of show their outcomes for 2021. Again, it was a very challenging year. The Housing Authority of Cook County is not represented in this chart. The Hacc requested funding to provide a case manager in the 2 senior buildings here in Evanston. Unfortunately, they have not yet been able to hire a case manager, so they're still working on that. And so they were not able to report for 2021. Our safety net outcomes, like I said, were a little bit varied. And so I took this long and sort of condensed chart that is included in the packet and just wanted to provide this information up in slides in case people had questions about the types of services or the number of service hours. And so I'll just go through briefly: books and breakfast, CNE. I will say that the Child Care Network of Evanston, they had their Learning Together program. That program was able to run for the first half of 2021, but because it ran out of funding, it was not running for the second half of 2021. So CNE does have a portion of their 2021 award that has carried over into 2022, but I anticipate that they will have expended that. And so staffs, if we were to keep all of the awards level for 2022, the amount suggested for CNE that would keep that program level is included in the packet, and we'll see it in another spreadsheet. We now have information for connections for the homeless and Interfaith Action. I do have to point out that there is a mistake with Interfaith Action, and the mistake was mine. I apologize. Interfaith Action was open. They opened from November 1st, and they stay open through the cold weather days. And in 2021, they closed in March, and I don't have that exact date, but those first 3 months, January, February, and March, that Interfaith Action was open in 2021 are not represented in the chart. Instead, the 61 days, Sue and I were thinking it's really from November through December. But you know, they were able to provide beds. The number of beds they were able to provide was a little bit lower than in past years based on COVID restrictions, but still running strong. Okay, we have Moran Center, Meals on Wheels, and North Shore Senior Center on this slide. I would like to point out that Moran Center and North Shore Senior Center, these numbers are not unduplicated. So using Moran Center as an example, a participant could start with, let's say, educational advocacy services, and then also need restorative justice practices or services, or school-based civil legal clinic services. So the hours are unduplicated, right? But the number of participants may not be. And that's also the case with North Shore Senior Center. Somebody receiving case management services might also be receiving additional services, deeper services that the agency has to offer. North Shore Senior Center also runs a grandparents raising grandchildren program, and the children in that program receive services, but those children counted are not reflected in the number of participants served, but that's something that North Shore Senior Center is working on adding into subsequent reports. Okay, in this slide we have peer, YWCA, and YOU. The same is true for peer and YWCA and YOU. These hours of service are accurate, but the participants might receive multiple services. Were there any questions about any of these safety net agencies? Okay, great. So this sheet looks at the awards agencies received for 2021, what they were able to expend, what they're carrying over. And then again, if they were to remain level for 2022, this sheet shows the amounts those agencies would receive. The amounts highlighted in blue for Hacc and CNE and YOU would come from 2021 funds, not 2022 funds. So that impacts the amount in a positive way, the amounts we have available for allocation in 2022. Okay. All right, so let me go back. Let me stop sharing. Sorry, it just takes me a little minute here. Okay. If there are no questions, what I'd like to do next is pull up the allocation spreadsheet that we can sort of play with, and we can start to enter totals. So let me do that now.
While Jessica is pulling that up, I'll just pause and make sure that there are no questions from committee members. Perfect. Thank you, Jessica.
Thank you. Okay. Let me move that over. Okay, can everyone see this? Hopefully just the spreadsheet on my screen and not.
We
the
see
rest
your
of them.
full screen, Jessica, just so you know.
Okay, let me try that again. My desktop is really messy. I apologize.
It is all right. It was cleaner than mine.
Thank you. Thank you for that. Okay, how's that?
That's great.
Perfect.
Perfect. Okay, so here's the way this will work. We do have the enrollment goals and the service plan goals on the right of the screen, but otherwise, as committee members talk about recommendations for 2022, I can add them in. That way committee members can see how the funds are looking and we can go from there.
Perfect.
Just one quick note. In some cases, because of the impact of COVID, there are some agencies that may not have made their full enrollment goals. I'm going to use Infant Welfare Society, Teen Baby Nursery as an example. They had reductions in the number of children they could actually have in the teen baby nursery due to space and things like that. So just want to point out, and Jessica, if there are any others like that, I just remember, there are some that were impacted by the restrictions or the greater social distancings and things like that of COVID. So I want to make sure that we make you aware of that. So it's not technically a performance thing on their part. It's a reality of.
Yes. Thank you for that, Sarah. I would say that I agree with you in that affects Infant Welfare Society, Interfaith Action, and YOU had some challenges with staffing. And so that while that wasn't necessarily directly COVID related, they were unforeseen staffing challenges that have really posed some challenges to the agency, but they are actively hiring. They've got a new finance team in place and they're really moving full steam ahead. So.
Okay, wonderful. Why don't we start with case management? We have 292, I guess we could do more, but right around 300,000 to allocate. I am going to assume, Jessica, that your proposed allocation for Hacc at 17.5 is because we've gone through they did not expend half of a year's of funding in 21, and we've already passed 1 quarter of 22. And so that amount plus what they carried over is 3/4 of a year, which is what we would, if they were to hire somebody in short order, they would have the funding that they've requested.
Yes, absolutely. Absolutely. And if I could suggest, we could start with the proposed allocations and make a motion on the proposed allocations as a way of opening discussion, and then we could adjust from there.
Perfect.
Reed, does that sound good to you? Okay. I'm happy to do that if that is all right with the committee.
Yes, I just need a motion to, I guess, to accept the proposed allocation.
Yes.
And for any new members, or for just as a refresher, just because we're motioning and we're not, we will then discuss and then have a vote.
Yes. It's not approving it just by making a motion. And
Correct.
yeah, exactly.
So I just need somebody to motion. That is a committee member.
I will move. So moved.
Thank you very much, Councilman Reed. All right.
Sec-
Thank you, Councilman Burns, I believe. If I.
Yep.
Perfect. So we have a second. And so we'll begin discussion. We've already, I've talked about, I will start with case management, and then we'll move to the safety net services. Is there any questions or discussion from the committee members on the proposed allocations for case management programs? I had one question if others don't. So family focus exceeded and far exceeded their enrollment goals, which is wonderful. Did the allocation, I mean, obviously they were a little short on their service goals, but given how far they exceeded enrollment goal, I think that's perhaps to be anticipated to some extent. Did that allocation, would that sustain this this larger enrollment?
So that's a great question. I do believe that we have heard from agencies and that case managers are hard to come by. It is not easy to hire them. It is not easy to retain them. This is a very challenging time for professionals in that industry. And so what I have heard from Family Focus is that the award really did stabilize that organization and prevented loss. We do anticipate for some of the programs that do rely heavily on meeting in person and holding groups. I know that there is a lot of anticipation around getting back up to full capacity, especially for their youth groups. And so, it's hard to predict, but I can say that Family Focus is a very strong organization, and it's an organization that is well known and well loved in Evanston. And so, yeah.
Oh, and I perhaps I didn't frame my question. I was just wondering if 125,000, if maintaining that amount was enough, because they served so many more people than they had anticipated, and given the challenging of the environment that they are in, that we are all in. And had they raised any concern about the amount?
No.
Okay.
That being said, I'm sure every agency would be grateful. No one would say no.
Of course.
Just a reminder, we are still, Jessica didn't point out that what we're going to do is the idea is to do the allocation, but at the same time, relook at in August, right? When we have more data again, and then we can make adjustments, and we will make that clear to agencies that remember the allocation amounts we're doing now. We're trying to say, yes, this will be your yearly allocation. We don't have our CDBG yet. We're pretty sure it's going to be very close to what it is, but there could be some adjustments, and we will have to make them aware of that. And I think we do want to give the committee the opportunity to look at the next, bunch of data, the next period of data, and before we absolutely finalize everything. So it's weird. We wish we didn't have to do it this way, but our federal government once again took forever to get their budget. So we don't want to wait anymore. We really want to be able to get people money for the first half of the year that they're working, and not have to deal with what we put everybody through last year, which was a totally different situation that we couldn't control, but so.
Perfect. Thank you. Any other questions? Any committee members have any questions on case management? And thank you, Sarah. All right. Well, oh, yes, Councilman Burns.
Yeah, I just wanted to kind of follow up, if not on your same point, maybe on something similar, Samantha, but just, yeah, trying to get a, I know this, I think this year, or maybe it was last year, but it was the first time that we started to put an emphasis on measuring the outcomes of our agencies that we provide grants to on an annual basis. Is that true?
Yes, absolutely.
And so I guess it would help, down the road to know, okay, we're measuring now, and we'll continue to get back some of those results, but what does that tell us? And then what should we do in response to it? And I don't know if this was what Samantha was getting at, but I certainly would be, is if we do want to adjust the amount that we give to organizations that seem to meet or exceed, their projections or expectations, would that result in them getting an increase in funding? Maybe not at an amount that makes it so we can't support the other organizations at acceptable amounts, but there's no good in measuring if we don't know what we're going to do after we get the information back. So that's just a thought for staff and for the committee to reflect on as we look at the next round of data.
And Councilman Burns, that is exactly, what I was saying. So thank you for saying it so clearly. It is essentially that, Family Focus was able to serve more and well over sort of what we had hoped and they had anticipated. And, I wanted to support those efforts. And then also, if there are other dollars, and I think, well, as we talk about safety net services as well, I do think as we think about future allocations and adjustments, the data and the past success should play a role in the upward adjustments. We will so that those funds are used most efficiently and effectively to serve the community. Sarah, are you chatting to us?
I didn't hit my unmute well enough. I wanted to just add one more thing to that, and that is, we aren't saying that the amount we are allocating for case management is really what is needed. And there may be, we also will need to look at how many more people need to get into case management. And I think that's something that we would like to talk about in August. And also, I think that will be a really big consideration when we look at 2023, what we're asking for and what we're expecting, because, it's something that, we originally thought we would be splitting funding between case management and safety net kind of 50-50, that's not where we've turned out. And I think we have to look at our overall program goals and how well we're able to provide that really sort of wraparound approach to really help people get services. But as Jessica pointed out, one of our huge challenges is even our agencies are having trouble hiring people right now to do that. So we're kind of between a rock and a hard place in some ways, but we absolutely need to pay a lot of attention to that.
Perfect. Thank you, Sarah. Further discussion before we move on to safety net services. All right, so safety net services, I'll walk through line by line, and then we can have a full discussion. So books and breakfast, a flat amount is the proposed allocation. Childcare network learning together is a partial allocation. Is that basically to get them to the full amount from what they didn't expend.
Yes, that's because they've got that 26,700 in carryover funds. So the 26,000 plus the 36,700 would equal their total request from 2021. And because they started the year fully funded and running, we anticipate that they would not have carryover for 2023, but that they would be able to expend their award in 2022.
Thank you. And I was doing that math quickly and just wanted to confirm my my math skills. All right, connections for the homeless at the 150, this at the flat level, as is interfaith action at 42,500. The Moran Center at 50,000 is also flat. Meals on Wheels, 30,000 flat. North Shore Senior Center Social Services has an increase from their 21 award of a little over 11,000. Jessica, they exceeded their enrollment goal by quite a bit, 178%. Is that the reasoning for the increase above the 21 allocation?
So the 35,000 was their requested amount in 2021. So you're right, it's not keeping them level with their 2021 award, but I did wonder if the committee wanted to reconsider their original requested amount, or if the committee wanted to keep them at level funding of the 23,750.
And if I recall the discussions of why we reduced their allocation, it was because they at the time did not have a large portion of Evanston residents being served compared to their other, or perhaps they did and didn't have it documented, but at least what they put forward, it was not a large number of Evanston residents compared to their overall, the population that they serve and sort of the funding mix. Does that sound familiar to others?
And I believe, Jessica will correct me if my memory is wrong, they had applied under, weren't they one of the ones that was moved from case management? Because they weren't really doing robust case management as defined, and they were moved into safety net. So that was kind of like, we don't really know quite what they are, how this is going to work out. They also had new staff who was actually on one of our last meetings. One of the things that I think that we saw in their safety net services that they were doing much, their largest category was basically benefits enrollment, which we both think is very important. And Councilmember Burns, that was something that you talked about the need for. And so that is a service that would perhaps, be really benefit, they could expand that with additional funding.
Absolutely.
Yeah, if I could also just add, we knew that North Shore Senior Center was providing services to Evanston residents, but one of our biggest requests was for them to drill down and sort of provide additional information about the specific types of services Evanston residents were enrolling in, and the number of service hours. And they were able to, produce that information. It was very helpful and illuminating.
Perfect. Any questions on this item? Because the peer services is flat at the 99,500. YOU, which we already spoke about. Oh, Councilman Burns.
Yeah, thank you, Chair. No, I was just going to agree that I don't know if it was North Shore Senior Center or if it was another I don't even know if I'm saying that, not yet, North Shore Senior Center, or if it was another organization, but I do recall that we reduced an allocation amount because of the amount of Evanston residents, or the lack of Evanston residents that they served, or the amount, however you want to look at it. I don't know if that was North Shore Senior Center, but I recall having that discussion on the committee. So two things. One, I think in this, we talk a lot about standard operating procedures in the business I'm in. I think as a standard operating procedure for this, we should try to capture those conversations. And as we're looking at this, I think even if we want to create another category, I don't know how to best display it, but I think it is really critical that from year to year, or conversation to conversation, we also have that information available to us and it's accurate. Because that is important, that we understand why certain decisions were made in previous allocation discussions. So that's, I don't know how we want to deal with that. I'm open, I think,
Maybe just a quick little column
Yeah.
that just says notes. And then, we just sort of note that we were, it was reduced below request for this reason.
Yeah.
And maybe for the next August one, for family focus, I would like a note of, the fact that they exceeded their enrollment goal for 21, revisiting the amount that they have, given that they've served so many. And it seems they were very efficient with the funding that they received.
Yeah, I agree. I think those are both really important notes. And then I don't know if that's, I don't know if we can go back and figure out what it was. And if not, it would be nice, Jessica, if you could share what they provided. I don't know if that's in our packet, or if it is, I may have missed it and I can review it after the meeting. But if there is information they provided about the specific services to Evanston residents, I think that would be helpful.
Yep. So I get two things. They were reduced because of the services to Evanston residents versus the overall population. And I can share the slide with information about their.
Jessica, I could also just read those because I've got the thing out, and maybe that would help where it's hard to. So one of the things is they did provide very detailed numbers on certain services and how many people, and these are Evanston participants who are in it. Now, they have a huge number of total Evanston participants, but what I think are the critical things that we were looking at, Jessica was looking at, is the 513 people who got benefits assessment. That is really, I think, a significant number of people who are getting a very necessary kind of help. North Shore Senior Center does do case management, and they do other kinds of counseling, but they weren't tracking it and documenting it the way we want. So even though they are doing a lot of that, or quite a bit of it in terms of numbers, 158, I don't think it is necessarily as robust, shall we say, as yet as we were saying that would fit the category, and that was why they were moved in the first place, moved into safety net. But I think that the benefits assessment and also the managed care, really trying to help people figure out how to get care, the 263 people. I actually think we're looking at those numbers, even though that we're showing the percent of the Evanston participants. One of the challenges is I believe that North Shore Senior Center basically captures almost every contact. And if they've had a contact with somebody, they are counted as an Evanston resident who received some level of service. And we said, well, that might be a single phone call taking care of one thing. That doesn't really, we're looking, as Jessica said, for a better, details on what those services are that are really safety net services where somebody is really getting something that will keep them from falling into, difficulties, having more trouble and move them on a path to regaining better stability and well-being. So.
If I could also say, because we do have a number of city staff working with our senior populations, we do see this as an opportunity to see how much capacity North Shore has to potentially work with additional Evanston residents in these specific areas. And I do think that that is something that staff can measure and bring back to the committee.
And just on that, one of the things that we might actually consider asking them if they are able to do is something like have hours at the Levy Center or something where they would reach, or, I mean, that might be something that we could explore. And there's nothing to say that all of the funds that we have to be allocated right now, maybe some, if the committee wants to say, we want to hold on an increase at the moment and see if we can find out more what they might do or what they might, how they might use those funds, and bring that back as the in the August discussion. We could certainly look at that. We will have to probably make some minor adjustments just based on whatever our CDBG grant comes out to be. So it's not like we want to change everything, but I think that what I'm trying to look at are ways that we can respond to the committee's specific questions and things that you're asking about. So if those are considerations you want to do, then that can be something you take into account in the funding right now.
Perfect.
It's easier to add than it is just take away. Let's put it that way.
Absolutely. Councilman Burns. Or is your hand still, was that a new raising of hand?
Yeah, it was.
Okay,
Thank
perfect.
you, sir. So just trying to get a sense of, so the 3,775 Evanston participants, how did they come up with that number? What is that based on?
So that is the number of Evanston residents in their database that received some service. As Sarah said, their process is when somebody calls in, they do an initial sort of intake to assess needs, and then participants are, funneled to the appropriate deeper services. And so I could certainly have a representative from North Shore talk about the gap between that initial intake and then where people go, or maybe why they don't engage beyond the intake.
And the numbers not unduplicated, because the 3,775 could be someone calling back twice, 3 times, or what is?
That is not what North Shore reports. So the 3,775, that number is not duplicated. That is their individual count of Evanston residents who contacted North Shore.
And the only reason I asked is because when I add up the numbers not unduplicated, unless I'm not saying the whole column, that's 997. So I'm just trying to see where everybody else went.
Yep, that's fair.
That's what we don't know. There
Right,
are
right.
a range of other services that
I see. Okay.
yeah, and that's why we're kind of saying like,
Right.
Okay.
And
Yeah,
Councilmember
I needed to play that out myself to be able to follow you. I see what you mean now. Okay. Yeah, that makes sense.
Yeah.
Okay.
That 997, that is an accurate number, but it's the reason it's not reflected in my sheet is because it's a little bit disingenuous. And that's why those numbers are not unduplicated. So one person could have received case management and also received counseling or services from the grandparents raising grandparents.
I see.
program. Yeah, so that second column
Yeah.
can be duplicated.
I see what you mean. Okay.
And this is where Sarah and I have talked about the gap between the services available and Evanston residents maybe who aren't connected to services, and how can we identify the population not connected and get them the services they
Does
need.
North Shore Senior Center have the ability to unduplicate those numbers, the 997? Because I see what you mean. I actually missed that too. Now I have it. That it's not even 997 unique residents, because it's not unduplicated as the category header states. So are they able to unduplicate that currently or not? Their system doesn't allow that.
Their system does not allow that.
Okay.
But it is something.
And if I can, sorry, if I can just point out for Councilmember Burns that the hours are unduplicated. Am I correct on that?
Where do you see the hours at? What column is? I see hours for Moran Center, I think.
Oh, I'm sorry. Maybe I'm thinking of Moran Center.
And so yeah, that's where it came from. The percentage of population is even probably much lower than this if you were to unduplicate it. So I think, yeah, that was what the concern was then. And okay, that was it. I was just trying to get clarity. And so Jessica, if you wouldn't mind repeating once more, or Swax, what you think. I think Sarah, you brought up the Levy Center as an idea.
Levy Center, maybe family focused, maybe. I'm just thinking of places, where we're likely to have a fairly large number of seniors. And, I don't know, this is not something that we can guarantee, but I think it would be worth exploring if they could do, especially as we're starting to get back to opening up and having people, in places, that might be something that we could certainly find out if they would be able to consider. And if not, we can understand that, but we can at least explore that for you, I think, and just see what their reaction is to, because, as I say,
do they provide any offsite services now, or everything currently is run through the North Shore Senior Center site?
They do provide hours or they have in the past provided hours at Family Focus, and they have also provided hours at Levy in the greater past. So like in 2015, 16, they did provide hours at Levy.
Okay, so there's some precedent there, which is
yes.
good. What does grandparents mean? I see that under services provided.
Yeah, I couldn't fit that all in. They run a grandparents raising grandchildren program. It's like a support group. They meet once a month. The children are provided, tutoring and additional enrichment services. The grandparents, it is a wonderful support group. And it's also a way for those grandparents to learn about additional resources in the community. Yep, they do a holiday party, and they provide gift cards to help offer support.
And last question. So we're counseling the grandchildren group benefits and assessment managed care. Are we saying that's all under social safety net? Does that fall all under social safety net?
Yes. Right. Those are all like additional deeper services.
Okay.
Yep.
Okay. Thank you. That's all. Thank you, Chair.
No, thank you. And I do think, especially as we anticipate the ending nationally or federally of the PHE, benefit assessment and assistance is going to be critical for Evanston residents. And we're going to see redeterminations turn back on for Medicaid. A lot of these public services that have sort of been held flat, and we haven't had to go through that complex paperwork. It's all going to turn back on again. And I think that's going to be clunky, to be just to be uneloquent and ineloquent. So I do think if we can work with North Shore, especially, that full request, specifically on benefits assessments and assistance, I think that would really serve the community well.
And one last thing, Chair, if I may, I don't know if we want to identify that opportunity first and then award, you know, what they previously asked for at 35,000. I think it's important to identify the work that can be done.
Right, and that's why I was suggesting the committee could wait to see what we come back with in August, you know, and what their response is and what their numbers are in August and you know, look at making an adjustment at that point.
Okay, thank you. And this is, I want to say this too, this is, and I don't know if anybody from North Shore Senior Center is here today, but this is not to pick on North Shore Senior Center. I think it's just us, at least me, trying to figure out how best to use the data and the information we're gathering. But what I like about this is that we're not just saying, oh, we're not going to fund them at the requested amount, but okay, well, how can we address the fact that they, you know, we don't quite understand how they're currently servicing or at what level they're servicing Evanston residents, and let's partner with them to find other opportunities to do it. So I just wanted to highlight that, especially if someone from the center is on the call. But I do think it's important that if we are going to measure that we make actions based on this information and that we're consistent, not just with North Shore Senior Center now, but with any other organization that we have questions about. Thank you.
Absolutely. And Jessica.
We do have Kathy Honeywell from North Shore Senior Center is in the audience, and she has raised her hand. If you wanted to hold to public comment or invite her to speak now.
I think invite her to speak now so that it's all fresh and that we're not trying to recall the discussion later. I don't know that I will.
Hello. Thank you for giving me an opportunity to talk. Lots of good questions about how we track our data, and just so you know, the way our system is set up, it would be difficult to pull out different data without kind of doing major programming changing. But we are very interested and willing and able to provide services, or especially benefits assistance services, in different ways and different times. And this is good conversation to see where we can have the most impact, because we have had enrollment events recently through Levy Center for energy assistance and Medicare open enrollment and whatnot. But if there are other opportunities where we can be helpful, we're definitely open to exploring that and seeing where we can be most helpful to the most residents.
Thank you so much. And Kathy, on the benefit assistance, do you also, you've done LIHEAP, Medicare open enrollment. Do you do CCP as well?
Yeah, we're a CCP provider, or we're the care coordination unit. So
Perfect.
we do assessments and case management for CCP. And we help people apply for Medicaid and SNAP.
Well, as a CCP, you have to, right? Like every member has, or they have to apply for Medicaid.
If they qualify. Yeah. So we help with that also.
Okay. And those are all very helpful.
Yeah. And we, along with our staff helping with that, we have a crew of volunteers who are trained to also help administer all these applications for these programs, which is a great way to involve the community in helping their neighbors. And they've all been trained, they all understand confidentiality and all of those other important factors that need to be addressed with people. But I think it's also great that we can get the community involved in helping their neighbors.
Absolutely. Councilman Burns. You are on mute.
Perfect. Kathy, no, thanks for being able to join us. So I just had, and this is just because I'm not familiar with a lot of this, so I have a few questions for dummies in a sense. But so, you know, when I hear senior, I think more Medicare, but you're saying you also you also can do benefits enrollment for people on Medicaid. you can age out of Medicaid in the way I understand it, right? I'm just trying to understand how that you don't.
Actually, Medicaid is
you-
more income and asset based. So there are many seniors who have Medicaid to help supplement their Medicare
I didn't know that.
benefits.
I didn't know that.
And there's a lot of older adults that need SNAP, which is the old food stamps program.
Absolutely.
So yeah, and Medicaid also, well, Social Security, Medicaid helps people pay for their prescription plans if they have limited income and assets.
And then, but there are age restrictions in terms of the community members that you can, serve with your programs.
It depends on the program. For example, for the community care program, somebody has to be 60 or older to qualify to get some services, multiple kinds of services at home. But for the caregiver support program, family caregivers could be of any age caring for an older adult, caring for somebody over age 60. And then there's kids in the grandparents program.
I meant more for the benefits enrollment service.
For the benefits, it again, it depends on the program, but for energy assistance, people just have to be income eligible.
Okay.
Kathy, can I tag on to Councilmember Burns's question? Because I could be wrong, but I think potentially what the council member was asking was, could you as an organization assist members with our residents with benefit assistance regardless of age? Like, so if we had a community event for, Medicaid and SNAP and LIHEAP, could your team help residents who were, 18 to 99, or does your organization just start assisting at age 60 or 50 or some other cutoff?
To be honest, we are most familiar with the programs that impact seniors. So for example, All Kids, we're not very familiar with that, so we don't help people apply for All Kids. But for the broader programs, SNAP and whatnot, we can help people of all ages.
And then, based on what you're experiencing, what is the most common benefit that's hard for seniors that you're finding that seniors aren't enrolled in?
That they're enrolling in?
That they're not enrolled in.
Oh, they're not enrolled in.
Yeah.
We still encounter a lot of seniors that actually qualify for Medicaid and don't want to do it because they're concerned about losing their home because of Medicaid estate recovery.
Oh, well, I don't know what that is. I don't know if you could quickly explain that, or I could Google it offline. But
it's actually something when the house is sold or when the older adult dies, then the state has the ability to recoup some of the costs that they paid from the sale of the home.
Okay.
And the streamlining of this and limiting some of that interaction, I think, was just passed on Saturday morning. And so perhaps that's something we can talk about too at some point, where essentially, if I'm recalling correctly, and I'm still bleary-eyed from Saturday morning at 6 a.m. Adjournment, but I believe the state is not even going to pursue estate recovery for anything under 25,000.
That's amazing.
So I think some of that information, as once it's signed into law, which we do anticipate, but it is not yet, I think could be helpful in that, because we see the same as there are the number one, and this wouldn't count because obviously these seniors have Medicare, but the number one area of uninsured is actually individuals who are eligible for Medicaid who aren't enrolled. So anything we can all collectively do on that front, I think there's a real opportunity.
Mm-hmm.
And Chair, I see Kathy Hayes has a
Yes.
question. I'll reserve my remaining 2 questions until after Kathy goes.
Perfect,
Hayes.
Kathy.
I'm sorry, my question is very short. So your grandparents raising grandchildren program is purely referral or only a support group? I'm a little unclear.
Actually, there's a monthly support group. case management for the families. And prior to the pandemic, we had an annual resource fair that we did in conjunction with Family Focus, so that families could learn about multiple resources available to support them. And the monthly support group kind of alternates between support group and educational programming.
The Family Focus provides the direct services or case management for the families.
We also provide case management for the families, for the grandparents.
Okay.
And to be honest, I'm not sure if Family Focus also has case management for the kids. That I'm not sure of.
Well, I was just concerned if some of the, and you can probably tell me if some of your grandparents are facing issues with court, if they have their children by relative, foster care or what have you, who takes lead on the case.
I would think Family Focus would on something like that. If there's a court related matter. And we refer to Center for Elder and Disability Law. We've actually had some families work with them on guardianship proceedings.
And Chair, just so I don't take up any more time, because I think we have another agenda item, or maybe I'm mistaken, but and I don't know if Kathy, this is too much trouble. What I would love to, if it's on the website, I can go there, but just to see a kind of a summary of some of the social safety net qualifying services that the organization provides. And I'm particularly interested in, the age groups you're able to serve through each program. And then I think that could help us all better understand how we can partner to expand when appropriate and when there's opportunities.
Our website was just revamped, so I couldn't tell you where it is on the website to find information like that, but I can send you some information.
Perfect. Thank you.
Kathy, if you would send it to Jessica, we would
Jessica can
get
share
it
with
to
you.
the whole committee. I think that would be
Great.
valuable.
Thank you. I'll do that.
Thanks.
All right. Thank you, Chair. That's all.
No, thank you. This was very
And thank
thorough.
you, and I appreciate it.
And thank you, Kathy. You answered all of our questions when you absolutely probably did not expect you. So I'm appreciative of your listening today and joining and helping us as we walk through all of this. And I think as we have not sort of finalized, I don't think we finished the chart for safety net services, but I do think, and after this conversation, at least, it does make sense with the recognition that the committee, I think, has sees a real opportunity and need for benefits assistance, and based off the answers that Kathy's given, I mean, I do feel comfortable with that full allocation of 35,000 over it's not in front of me right now, but I think it was like 26. $23,750. I was way off. So thank you, Jessica. But I saw Councilman Burns either unmuted or raised his hand. So I want to give him a moment as well.
Oh, I don't know. My hand was raised. That's but I did. I just want to reiterate. I think we should just consider what we want to. Whatever we do now, we have to remain consistent. Not just when there's questions with North Shore Senior Center, but any other organization. And so again, I think I just want us to reflect on if it makes sense to hold off allocating the full amount now until we identify what those opportunities are, those specific opportunities to expand program and Evanston residents. So if that's exactly what you just said, then I misunderstood what you said. I might have misunderstood. Because I see you putting 20, I see somebody putting 23,000 in now, so I don't know if, but that would be my recommendation, is that we fund at the same amount, and then we continue this discussion about how to expand the services to Evanston residents. And I think we can quickly come up with a few different opportunities. I certainly can. It sounds like there's already inroads to Family Focus, but I'm more than happy to join those discussions with Dara Munson, who's the new president and CEO of Family Focus, and any other organizations. So
Perfect. So then I hear from Council Member Burns, keeping it at the last year's allocation, with the recognition of really wanting to get to that full allocation of that 35,000, but just wanting more details on how we can make sure that those dollars are used for Evanston residents and in a manner that best serves the community, and probably focusing on that benefit assistance, at least from the conversations. Did I capture that right?
yes, perfectly.
Perfect. Anybody have any other different position, or are folks all comfortable with that allocation, with the recognition that we'll revisit it once we have firmer details? And Sarah and Jessica, can we revisit that before August? Do we need to wait till August, or is that
We wouldn't absolutely have to, but I would hate to make multiple. It's a lot. If we could keep things in sync, because we won't really have, when do we have our next report? I mean, I think that is also something that we could look at. And when is that going to be, Jessica?
So one of the things that staff is going to ask the committee tonight, the next report is in June, mid-June, and staff would like to push the June meeting back so that agencies have the opportunity to get in. That'll be their mid-year report, and staff has the time to review those outcomes and can present to the Social Services Committee. And so we're hoping to push the June meeting back as long as we can, maybe to the last week of, July. Reports, the period ends in June, I'm sorry. And so we're hoping to push back the July meeting until the last week of July, so that staff has time to compile information from the reports.
The one thing I would flag on the timing is that there is potential that we would see the public health emergency end in July. And so redeterminations would start again in July or August. And so that is like the one.
And what's that? Help me understand that gap, Samantha, because I think I understand what you're getting at. I just want to better understand. So that redetermination period would start when, and then we would take another look at what we would award North Shore Senior Center at what point. I'm just trying to.
So my understanding is that the Biden administration has committed to states, and we believe that this is a fair commitment and one that will hold, that they will give us at least 60 days notice before the public health emergency ends on the federal level. Once the public health emergency ends, redeterminations for the Medicaid program, and I believe for SNAP and for all of these other benefits, start back up. And right now, at least for Medicaid, nobody has been removed from the program for eligibility. And so once the public health emergency ends, we're going to start to see that process. And we anticipate that for a myriad of reasons, it's going to be pretty complicated. First of all, people aren't familiar with getting this paperwork. They haven't seen it. Sometimes we're going to have people who've seen it for the first time. People have moved over the course of 2.5 years. So it really, from a redetermination standpoint, is probably going to be an all hands on deck situation. And so we're always hoping that we will have more time than sometime in mid-July, but it is a potential there. I guess, so that was like the only, like the timing of all of that was why I wanted to sort of potentially revisit this before August.
So you're
But
thinking that in mid-July is the projected month?
we would know, I believe it's the 18th we're anticipating
18th of June or?
of April, we would know. That would get us to June. I think we are anticipating, there is a date that it is anticipated we would know, and if it was extended, it would just continue to be extended. Sarah or Jessica, do
beyond-
you know the date by chance?
I'm so sorry, I do not.
Okay.
And,
I
and that
will-
it would be extended, Samantha, beyond June?
Beyond
Extended?
July, yes. So we
July,
would know,
okay.
yeah. So in May, next month, we would know, by our next meeting, we would know whether or not the public health emergency would extend to mid-July. So I think we could keep this number here, and then we'll have a better sense of if the public health emergency is going to end. Maybe we want to talk about this even before the reports come back, just because we know it's going to be a pressure point.
Yeah, I would agree with that, as long as staff feels that it wouldn't throw things off too much. But I certainly understand the concern, and I think it's important we work this out before that period starts, because that's, especially if we feel like the service that we want to expand is benefits enrollment, then we want to make sure they have what they need to assist the community during that period. So I follow your line of thinking completely, and would love to hear from Jessica and Sarah about how you can we revisit this at the next meeting and decide then when to make that.
Sure, if I could share my screen again. This is our timeline for funding, and please help me figure out how it meshes with what the state has going on. But if the committee were able to determine allocations at this April meeting, it would go to Human Services and City Council in May, and that would allow staff to enter into agreements with agencies and fund for the first half of 2022. And we were thinking about, revisiting allocations with our HUD grant amount. But what I wanted to point out was that our application for 2023 funds would actually open up around August. The application has historically been available to agencies in August. They take, time in August to complete it. We have our hearing meetings in September, and then there's sort of deliberations about the 2023 allocations in October, November. The city's budget comes out in November, so there's a little bit of wiggle room there. But if I could offer anything that would impact North Shore Senior Center or funding, in addition to looking at their 2022 award, perhaps we could also consider their 2023 award and have more information about the services that they were able to provide in the second and third quarter, if that would be helpful.
Yeah, I mean, if I'm understanding, we could, hold the funding now, but even increase it beyond the 35,000 in August for next year, for 2023, if I'm following everything correctly.
Yes.
Okay. And I don't know if that addresses your concerns, Samantha, about the timing of it all.
I think it does. I think especially given those two together, and I hope that I think we've made it probably abundantly clear now to North Shore that we are very interested in their benefit assistance and what they could potentially do there and how we could help them as an organization.
I just wanted to say, I don't think it would be a good idea to start allocating 2023 money at that time. But we could look at, just because I'm concerned that then if we're having an application, I don't know how we would start doing that with one agency. So I think
No. So I must have misunderstood. So I thought we would be deciding on 2023 allocations in August. So that would just be
No, that's when the
application period
application
is-
opens.
Okay, I misunderstood. Okay.
Yeah, but I think one of the things we could look at, and because quite honestly, I didn't even have this on my radar of the, going back to the complex paper-based, everybody having to get all their documentation. One of the things we may want to weigh is we aren't allocating all of the funding that we're estimating for 2022 at this point, because we're still holding off, that we may need to consider using some of the funding that we're thinking of being reserved for support services to address this, because it could really be an immediate and critical need that, quite frankly, just wasn't on our radar. So I think that's something we should really consider. And I think that if we're going to learn, and hopefully by about the 18th, I think you said, Samantha, then we could, and then we should be getting our CDBG by mid-May. And so I think we might be able to move more quickly than, I have to be careful because Jessica's the one who does all the work. I'm like saying, oh, sure, we can analyze all this, but this might be a sort of need that is not looking at everything everybody's been doing, but how do we perhaps look at funding specifically addressing this need? Because you're right, if we have everybody falling out of services because that would be a disaster, that would, we probably would need to consider looking at using funding to keep that from happening and going back to the sort of traditional theory of our way we're allocating money. I mean, it's like we're not out of the pandemic yet, and we're not out of the impact of it. And I think that really trying to keep some flexibility to respond to what is happening might be, we might want to be doing benefits enrollment and getting people, we might want to have very specific events just to try to crank people through that. I just don't know. I hadn't even thought of that. And I really think, and I think that it might be something that we could then talk to agencies. How can we do this better? Because it's absolutely a huge, huge issue.
And the last thing I'll say on this point is, and again, if everybody agrees, and I think it makes sense to kind of hold off at least to the next meeting. And the only reason I bring this up again, it's we're talking about North Shore today. We'll talk about another organization another day, but it's that in order to set up the right incentives, the data we're measuring has to have consequences. And I'm searching for words that aren't as punitive. Consequences is the first best word I can come up now, but I'll get better at this. But it has to, there has to be an effect of the data if we're going to set up the right incentives around this new way of doing things on the committee. And so that's why I think it's important to kind of hold off and then remain consistent, be a partner to North Shore Senior Center, and make sure that we find ways where they can expand their services to Evanston residents. But I think it's important we kind of hold tight on this, if at all possible, and so that's all.
Jessica.
Thank you. I was just going to ask, this doesn't only affect seniors, does it? It affects anyone on Medicaid? Okay. Yeah, that's what I thought. So yeah, benefits enrollment for all.
And it sounds to me like it's on lots of different benefits, not just Medicaid, right? Yeah.
That is my understanding. My experience and focus is on Medicaid,
right.
But my understanding is it is not exclusively Medicaid.
Okay.
But I'm watching this. We are watching this very closely. So as I get more, I'll send it. I'll put that on my list of folks.
Okay. Jessica's going to pull our chart back up.
Okay. So
Right.
left off with YOU.
And we're recommending no allocation for 22 simply because they have not spent anything from 21. So they have full carryover, full year there. That is logical to me. And then YWCA, they spent their full amount. So we're recommending that we allocate it at $35,000, another full amount for them for 22. And so that we've had a very thorough discussion on all of this. I think at this point, we are able to, I have no other questions. I think we're probably able to vote on the 22 allocations.
Yeah, and Chair, I just wanted to know how much do we have total? Not total recommended, not what we're recommending, but the full amount that we have. Is that the 660 or?
Is it the, just as it the one?
No, I apologize. I should have created a slide around this. So the amount we have to allocate is a little bit tricky. We have $736,373 in local funds from our Human Services Fund. So we know we have that right off the bat. Then our 2022 Cdbg amount, we actually, because we don't have our award amount yet, we use an estimate. And Sarah and I are very conservative about the amount we estimate. And so the estimated amount of Cdbg was 1.8 million plus prior year income. And we do know our prior year income. And then our public services, our portion allotted to public services is 15% of that total. So again, using a very conservative estimate, we believe we will get at least $285,375 in Cdbg. So we hope we get more, but if we don't, we don't believe that we'd get less than that. And that's how we came up with our total estimated fund or amount for public services at $1,021,748.
And I think, how much were we holding back for support services at this point?
So if the committee, you know what, I'm sorry, I'm going to have to move
that, I think.
Screen. That category estimate with the way awards are now is $216,798.
So we also have flexibility because we still haven't used up our 2021. So, you know, I think that there is some flexibility. And I think that what we can look to do, as I say, I hope we are expecting to get our Cdbg amount confirmed by the middle of May, because it was the appropriations bill was signed on March, in March 15th. And so April 15th, May 15th, they have 60 days to get us their allocation. So it's got to be around that time. And so we will be able to finalize that then. And, you know, I think there might be a possibility if we know that, or I think what we could certainly shoot for is if we know that the emergency is off and that we have to go back to, you know, getting people re-enrolled and checked and confirmed that they're still eligible and all that stuff. We might be able to at least start talking to agencies, obviously, when we have our grant amounts confirmed, and maybe even make this a topic at the June meeting, maybe. But I think it would be, you know, if we're really saying we really need to focus on addressing this need to make sure people get enrolled or re-enrolled or confirmed for eligibility, not a, you know, so it would be kind of that pivoting to address that specific need and determining if some of these funds we're talking about that are currently even being held for support services could be put against that if we feel that there's a need to put more emphasis on that.
Sarah, I apologize. Were you asking about the amount we had available in support services potentially for 2022 or the amount we still have for 2021?
2022 is what I'm talking about. And
Okay.
that's the 210.
Well, it's actually now 216,790.
Well, that's only if we don't increase, if we were to increase,
Correct. If
or sure,
we
it would be the 200 and, I'm reading from the memo. Anyway,
Yeah.
it's a little over $200,000. So there's money that could, I mean, we could say we need to reallocate that or allocate that toward a different purpose, which is getting these, benefits, re-enrollment, stuff like that.
Councilmember Burns, is that helpful?
It is, thank you.
Perfect.
Okay.
All right. We've had a very thorough discussion. I hear no other comments. So now we are voting on the proposed allocations or the recommended committee allocations for 2022 for case management and for safety net services. We've already had a motion and a second, so now we just go through the roll, correct, Jessica?
Well, Sarah, I might need some help with this. In years past, we've gone.
Traditionally, we have read them, but one of
I
the-
can read them.
Yeah, and part of that was because we were using a big screen in the council chambers and people couldn't always see it. But if you would read that would be great.
Absolutely. So we are making the committee recommendation of $125,000 for family focus for case management, $17,500 for the Housing Authority of Cook County, $75,000 for Infant Welfare Society, $75,000 for the Moran Center, for a total of $292,500 for case management. We are making the committee recommendation for allocations for $45,000 for books and breakfasts, $36,700 for childcare network, $150,000 for connections for the homeless, $42,500 for interfaith action, $50,000 for the Moran Center under the safety net services, $30,000 for Meals on Wheels, $23,750 for North Shore Senior Center, $99,500 for peer services, nothing for 2022 for YOU, and $35,000 for YWCA, for a total of $512,450 for the safety net allocation, services allocation.
So moved. So we're voting.
Second.
Thank you.
Jessica, are we ready to call the roll, or did you need a second?
I'm sorry, I need a second, please.
Could I have a second? I cannot second, correct?
Right.
Second.
Perfect. And now let me stop sharing my screen so I can see everyone to do a roll call vote. Archana.
Yes.
Thank you. Amanda.
Aye.
Chair Fry, Olds Fry.
Yes.
Kathy Hayes.
Yes.
Demita Cravens.
Yes.
Thank you. Sheree Lackey.
Yes.
Vice Chair Ohanian.
Aye.
And Councilmember Burns.
Aye.
Excellent. Thank you.
So moved.
So moved, and so I'm sorry. Perfect. So we've made our 2022 committee allocation recommendations, and those will go to the Human Services Committee 1st, correct?
Correct, yes. And they meet on the first Monday in May of the month, so it'll be May 2nd.
Perfect. All right, we'll move to the next item on the agenda, which is updates from the Support Services Working Group. And Amanda, I believe you are going to provide.
Yeah, I'll just give a brief kind of update. So Demita and I met with a couple of community representatives to talk about the support services. And if you recall, that was sort of how do we want to use that pot of money? Our committee thought that counseling, possibly psychiatric services, and then there was the assessment services, diagnostic services was the other possible item. So we had representatives from the Moran Center, YOU, Child and Infant Welfare Society. And so we talked with them about the services that would be most impactful for their clients and for the community. And we talked a little bit about eligibility criteria that would promote equity among participants, given that the funds are limited, about the 200,000. So, we had a great discussion, and it seemed like there was some consensus around counseling services being most useful, both individual and group and possibly family. The organizations talked about, particularly youth benefiting from some group counseling, and that there aren't really as many services for elementary age kids around this, but it's really a growing need. They also talked about seeing some interest from clients around telehealth, but that there are still many youth and adults that really prefer in-person services still. So there really was kind of this, so there was sort of this push, I'd say, mostly for counseling services. We also talked a little bit about how to allocate the funds. Is it a session limit? How do we know who's really eligible? Should we go with first come, first serve versus some kind of other criteria? And the idea around using a vulnerability index came up as a way to kind of include a diversity, equity, and inclusion component to that, and really kind of allocate services to those who might need those most. And then lastly, regarding psychiatric services, I guess the group sort of felt like there was a smaller need around this than counseling, but still somewhat of a need. They talked about lots of times sort of a lot of clients being sort of right under that crisis area. But if they could have psychiatric services, that's something that could keep them from the ER. So there was an idea of kind of possibly using a portion of the funds for, to identify providers, but it is going to be challenging to find providers, I think. And then there was also some consensus that the assessment services just weren't as high of a priority. So Demita, chime in if there's anything that I have misrepresented or forgotten, but it sounds like the group was really mostly interested in counseling services, possibly some psychiatric services.
Yeah, Amanda, you pretty much nailed everything. I think we also talked about where there is a need for psychiatric care, that it might have to be something like psychiatrists maybe volunteering their time to try to come in and help out, because their list is just as long or longer than therapists. For people, it's really hard for people to even obtain psychiatrists at this point. So they'd probably have to kind of do some off the books work if possible with us.
Yeah, so we, wanted to see if our committee here feels prepared to vote tonight on prioritizing the counseling services, individual and group, for these safety net funds. But before we kind of do that, just wondering if there was any additional information that people needed to help make that decision. And then the idea would be that if, once we make this decision together as a group about what services to prioritize, that at our next meeting, Jessica could, and staff can come prepared with more information on how to evaluate those services and implement them. So are there any questions that people have?
Councilmember Burns.
Yeah, thank you. This is good work to the subcommittee. Yeah, no, I mean, I think I'm definitely on board with prioritizing individual and group counseling. I did want to just refresh myself on the 3 areas we looked at. So it was diagnostic, psychiatric, and then the counseling. Were those the 3 areas that we looked at?
That's right, yeah.
Okay. And the psychiatric is more towards prescription fulfillment or fulfilling prescriptions or making or whatever that, however you say that, but that is that the work of
Prescribing, yep.
prescribing. Okay. And I just, if you could try to explain that once more, is there a barrier to that being as effective as we may want it to be? I'm just trying to better understand that part.
For the medication,
the psychiatric services, yeah.
I mean, I think the main barrier is just having providers and having long wait lists. You know, there are a number of people that need psychiatric services, and it can be really effective in helping people manage a mental health condition. The issue is just getting people in, you know.
Okay. And then
and they're expensive.
And they're expensive. Okay. And these are like individual, I don't know, like providers, or I'm just trying to think, there's no like hospitals that provide this service more affordably than maybe some of the individual providers. I don't quite know how it works, but I'm just trying to see, are there alternative options that are more affordable?
I think right now, although Jessica, jump in if I'm wrong, we are just voting on the prioritization, and then Jessica will come back on what that could potentially look like. But I will say, I think hospitals have psychiatrists, but often those psychiatrists are treating members and our patients in crisis. I mean,
okay.
that have gone through the emergency department.
And then lastly, the diagnostic services weren't really a high priority. Do you know why? Or just curious, what, if you can, summarize what some of the statements were.
Yeah, the members from the community really felt like they didn't see as much of a need around particular diagnostic services, because as they're providing counseling, they would do an assessment with a person. As they come in, they're going to assess them for their needs, give them a diagnosis if needed. And they felt like it was sort of, that it wasn't necessary to kind of have this extra thing. And that and even just sort of, some of the comments were around, if we're just meeting with people to give them a diagnosis, it felt like putting the cart before the horse, because oftentimes people need diagnoses to get insurance payments. And so they didn't want to just meet with people for that sole purpose, because then what kind of services are they going to get? Like, it's almost an ethical issue of, you meet with someone and give them, you assess them and there's a risk or some kind of diagnosis, but you can't provide the service. That sort of felt that they wanted to prioritize the service over just a diagnosis, and that as a part of the service, they would be getting an assessment as part of that role. Does that make sense?
Yeah, that makes sense. Yeah. But to be clear, it wouldn't necessarily be the agencies providing that diagnosis. A doctor would have to do that, right?
No, it would be the counseling provider that would do that. That's just a standard practice that they would, when they meet with someone, they want to assess their needs. And that's the
And that's sufficient. It doesn't need to be you don't need to see a doctor to be officially like diagnosed.
That's right. Yeah.
You can see a counselor. Okay, I didn't know that. Okay. That's all. Thank you.
I just wanted to raise a question, and again, this is my own ignorance, but I am thinking in terms of what you were saying about back to the old procedures for a lot of benefits and a lot of federal benefits if the emergency burns off. I don't know. I always thought that enrolling in Medicaid required a very thorough assessment, and I could be completely wrong on that. Is that something that would be a concern? I just don't know enough about this.
Yeah, so pre-ACA, if you were a childless adult, the only way to become eligible was to either be a senior or a person with a disability, and mental health disabilities were part of that. After the ACA, thankfully, it's basically strictly income based, and so now if you're going through for eligibility for somebody who has a disability or a senior, the application process is much more cumbersome. But if you're going through just sort of traditional Medicaid, it's income based, and it does not require as extensive of information. So your memory serves you correct, but we have addressed that.
Yay. I just get scared every time the federal government goes back to normal, because it just sounds onerous to me.
Yeah. And what is interesting in Illinois, it is a paper application with a barcode. You have, like, if you aren't set up online, I mean, it's clunky.
And we, as I say, I know just enough to be dangerous and think of things, but I don't know how real they are. So I appreciate that.
Perfect. Amanda, I hear that you were asking for a motion from the committee to prioritize the counseling, individual and group, for the support services funding. And did I capture that correctly?
Yes, perfectly.
And so then we will need a motion and then a second. I guess you could move, I believe.
Okay.
And then just a quick question, last question is just that, is there a certain, because I don't have my packet in front of me, but is it like a certain percentage we're voting on today? Like we want to allocate 80% towards counseling, or what? I just want to make sure I understand what you would recommend, what the subcommittee will recommend.
I mean, it's a good point. I mean, most of the committee, the folks that were at this work group, wanted counseling. There was a small number of people that wanted psychiatric services too, and we didn't really hash that out, like what percentage or how much. But there was an overwhelming consensus that counseling, is something that we should do with this. So I guess I'm putting forward that we just prioritize the counseling. We could certainly hash it out some more together as a group if people, wanted to or want to approach that differently. But everyone did feel like counseling should be prioritized.
No, I just wanted it to be clear, and I think it is now, that the recommendation is that we allocate 100% of the support services funds towards counseling, at least for this, allocation period.
Yeah.
Okay. Thank you.
Yeah. So should I put forward a motion for that then? Okay. I move that we prioritize counseling at 100% of the funds for the safety net services.
Social,
what is it?
Support
services.
I think it's support service.
Thank you.
I was like, no, we did safety net already.
Okay. Yes.
And then I need a second for the support services.
I'll second.
Thank you. And then we'll call the roll.
Thank you. Archana.
Aye.
Thank you. Amanda.
Aye.
Thank you. Chair Oldsbry.
Aye.
Thank you. Kathy Hayes.
Aye.
Thank you. Demita.
Aye.
Thank you. Sherry.
Aye.
Vice Chair Ohanian.
Aye.
And Councilmember Burns.
Aye.
Excellent. Thank you. Staff appreciates this direction, guys. Thank you.
Wonderful. And thank you, Amanda and Demita for the work group and for meeting and for really moving this forward and bringing back those recommendations. I truly appreciate it. And Jessica, staff report.
Thank you so much. So I already shared my slide with the timeline of our application or our allocation process for 2022 funds and also the beginning of 2023. I did want to share with the committee that staff had the opportunity to talk to our counterparts at Oak Park. And Oak Park is pretty similar. They distribute about 1.3 million in funds to 20 agencies, and they do use a hybrid grant and fee-for-service funding model. They focus on 3 areas: therapeutic services, substance use prevention, and support for people with intellectual and developmental disorders, with a particular focus on youth early intervention, assessment, and education. They did mention some challenges, and they also said that the outcomes that they track are based on the SAMHSA determinations. And I've heard members, particularly Councilmember Burns, ask about how we are going to measure outcomes. And I would like to say that staff would like to come back to the committee now that we have this direction in May, because I did look up the SAMHSA determinations, and those 5, well, let me say this, I can present the SAMHSA determinations, but then I also wanted to present some metrics from the Illinois Children's Mental Health Plan and the Mental Health Association. I think between these several sort of national organizations and then drilling down to Illinois, we can look at determinants for adults, youth, and sorry, I'm losing my notes here. The Mental Health Association also looks at workforce development. So once I have the opportunity to sort of present in more detail in May, the committee can review some of these metrics and decide if any of the ones presented might apply here in Evanston. So if we wanted to, for example, look at benefits enrollment for seniors and adults, that could be one of our determinants from the conversation tonight. We could look at youth who have experienced one major depressive episode, and look at reducing those episodes in youth, or look at connecting youth or adults with major depressive episodes to services as one of our determinants. So this is just sort of meant to be a little preview to say that we hear you want metrics and outcomes, and staff is planning to present so that the committee has the opportunity to review and decide what is best for Evanston based on what's happening sort of at a national or a state level.
And I think there's a real value if we can use these existing metrics, because one of the worst things in the world is creating new metrics for everybody to try to track. So if there are standards that,
Yeah. And then the only other thing that I wanted to mention, and maybe we don't have to decide anything tonight, is again, pushing back the July meeting to the end of the month. So agencies have the time to submit those mid-year reports. We think that those are going to be big reports, and we'll get outcomes that the committee can use to.
Maybe what we could do is send out a doodle poll or something for some dates. That might be a good way of resolving that. We don't want to come in without as much data as possible. I mean, we really think it's important to bring you as much of the data to be able to take into account.
I think that makes a lot of sense. I think a doodle seems appropriate, and I think moving it so there's enough time. We want to be efficient with our utilization of this meeting and not say, oh, we have to discuss this all next month because we don't have enough.
Yes. So with that, I think staff are done.
All right, wonderful. We've already had now 2 public comment periods because we had North Shore speak earlier, but we will offer an opportunity for public comment again. Please feel free to put it in the chat, raise your hand. I'm seeing that nobody has done so. Okay, great. Or I'm seeing that staff is telling me that nobody has done so. I cannot see that easily. And with that, I believe
Sure,
you.
I just had one more quick comment just to the working group. I also wanted to say I like the idea about the vulnerability index. I just wanted to I'm looking forward to seeing how that comes together.
Thank you, Councilmember Burns. I thought the same thing, that seemed like a nice solution to that first come, first serve sort of approach where it would really benefit agencies that perhaps were just more streamlined, that the vulnerability index did seem like a meaningful tool. So thank you for flagging that. I think that's very, very helpful for staff as well. And with that, I hear that Councilmember Burns is motioning to adjourn. All right, and we do not need to call, we do not need to do a roll call. We are adjourning. Thank you, staff, for all of your work. Thank you again, Amanda and Demita, for your work on the working group. And as always, thank you to all of the committee members for a long committee meeting, but a thorough and important one. Thank you. See you next month.
Good night.
Thanks all.
Good night.
Good night.